Good day, I'm Marco Daoura and we're here at the American Telemedicine Association 2016 in Minneapolis, Minnesota. And we're here with Andrew from Zoom.
Hi everybody, Andrew Cannata from Zoom.
Telehealth and telemedicine are the focus topics of this conference, and telemedicine platforms come in very different flavors. Some include hardware, others are software as a service, some are plug and play, and others are very flexible and give you an API toolkit that allows you to customize your workflow. Nevertheless, they all require reliable and secure communication, quality audio and video feeds, and they all have different pricing models. So, Andrew, why don't you tell us a little more about the Zoom solutions and what makes them special?
Sure. Thank you very much, Marco. So Zoom Video Communications is a cloud-based collaboration platform. Why do I say cloud-based collaboration platform and not just a video conferencing platform? It's because in today's world, collaboration is more important than just the video and the audio feeds. Those are very important, especially in telemedicine and telehealth, because you want to have a very crystal clear experience with your physician, especially if you're a patient at home and not going into an office and being face-to-face, right? So the video and audio are very important. But what's even more important to bring the patients and the physicians together is the collaboration. Something that has a really powerful screen sharing so that you can share something like, x-ray results or possibly patient record information with the patient in the home. Being able to co-collaborate over a presentation share like that so that the dialogue can continue back and forth like it would if you were in an office with the physician. Being able to share other instruments like a stethoscope, being able to send these instruments into the patient's home so they can take vitals and send them back to the physician in real time. Those are very important collaboration tools that a solution needs to have, and that's what Zoom offers. We offer this all in a cloud-based platform. We are a fully software company, so we provide iOS, Android, BlackBerry, Windows, Mac, and even Linux applications. What we're really seeing in our space is what is setting us apart is our quality, our features, our pricing model that makes it so affordable for physicians to communicate with their patients. And also our integrations. So we offer a full REST API to integrate this into your web solution if you would like. We also offer a full SDK package so that you can implement this into a mobile application. For instance, Care Innovations is one of our big telehealth customers. They've implemented our SDK into their mobile application for their iPads that they send into patients' homes so that they can communicate between patient and clinician. So integration and collaboration are very important in the telehealth and telemedicine.
That's great to hear, Andrew, and I appreciate you talking a little bit about your pricing model and affordability. Tell me a little more, how would a health institution or a clinic do the installation? What it requires from them on the remote end and at the patient side where the technician or where the patient might be? What is required from a hardware or application perspective, since you're only a software as a service? What is required on both ends?
Correct, yeah. So what's even more important, and this gets into what is required on both ends, what's even more important than the collaboration aspect is the ease of use, right? When you send something into a patient's home or you ask a patient to join you over any web application, you need it to be simple, because if they can't get in or they have a bad experience, they may not use that service again. Yeah. So Zoom's simplicity is what sets us apart from other people. We do require a very thin download for both the physician and the client in home. It does not require any administrative rights to download and install, and it's seamless for the user. The physician would send a meeting invitation to them. They would have a link in this invitation that they click on. The click of that link will initiate the download and install process if we detect that the software is not on the machine. So once it is done installing, it will automatically drop them into the meeting, and it's very seamless. It's transparent to the user on the far end. And that's what you want. You want it to be very simple. So all you really need is any one of those devices that I listed before that has video and audio enabled, and you can have a Zoom call.
That's great, Andrew. Tell us a little more as well about your flexibility with your API toolkit and how that might allow certain individuals or companies to customize for their workflow.
Sure. So our API toolkit allows you to schedule and start meetings directly from your web portal. So a lot of telemedicine, a lot of telehealth customers have developed these really robust web portals for their patients to come in, maybe see, you know, their patient records, maybe schedule appointments. Well, in that scheduling process, they can actually schedule a virtual meeting using Zoom. Our APIs on the back end would allow the physician to do that. They would simply use the schedule that they have now, implement our APIs to return them a meeting link, and send that over to their patients. So it's very easy. They can fully brand their web page and have our APIs running on the back end. And then our mobile SDK is very powerful because it allows you to create your own native application on an Android or iOS device, right, that does more than just the audio and video, but when it comes time to collaborate, you put that application as a wrapper around our video window, and it's just a fully immersive solution for the patient because they're not jumping between separate applications to do multiple different things.
Good to hear, Andrew. And from the perspective of video feeds, you obviously can support multiple video feeds, multiple data points.
Absolutely. So having multiple video feeds is very important, especially in telemedicine. You want to be able to communicate over the primary video feed with the physician while being able to share other instruments over a presentation feed. And what's great about our product is our presentation feed sets us apart from our competition. We can do full HD, 20 to 30 frames per second, plus we can share audio over our presentation feed. That means any instruments that need to share audio or any videos that need to be played back during that live session.
Great. Thank you again, Andrew. Appreciate your time. Zoom, guys, check him out. Thank you for listening. ATA 2016, Minneapolis, Minnesota.